Hello, my name is Melissa Domchevska, and I will be discussing the influence of smoking on systolic blood pressure. Increased blood pressure has various serious negative health effects, and I will discuss how these health concerns are impacted by the health behavior of smoking, in addition to the covariates of diet and reported overall sleep quality. I will then also discuss what might make someone more likely to engage in smoking. Before I get into why this is such an important topic, I want to go into some quick background information of the dataset I used to answer my research questions. I'll be answering two research questions using the study of women's health across the nation, which is a longitudinal study that has examined the health of women during their middle ages and what physical, biological, psychological, and social changes occur in a woman's body and a woman's life when she reaches this stage of life. This study and the data it gathers helps doctors and public health professionals improve the quality of life for women in this period. This study was conducted in 3 phases. Beginning in 1994, focus groups were conducted in the initial phase to ensure those who would eventually be enrolled would be culturally diverse and the study would be culturally sensitive, which would create a more generalized and inclusive view of the overall population. This would also help recruit and retain women from various walks of life. The second phase of the study was a cross-sectional 15-minute interview that occurred either in person or through the phone. It targeted women between the ages of 40 and 55 who could read and speak the 4 designated languages: English, Spanish, Cantonese, and Japanese. Ultimately, the study enrolled 3,302 women aged 42 to 52 years old who had a uterus and at least 1 intact ovary, reported a menstrual period, and did not take hormone medications in the last 3 months. I have also included the races and ethnicities of this first baseline group. The study is now in its 5th funding period, and according to SWAN's website, its 15th visit. Through SPSS, I ran several frequency analyses to obtain key demographic information of the current dataset. There were a total of 2,448 women with a mean age of about 52 years old. The majority, 65.4% of women, were married or currently living as married. 82.4% reported having children or stepchildren. The majority of women had a total family income of over $100,000. However, I bolded the less than $19,999 category since that is the target sample for my second research question. And the majority of women reported English as a language used in this interview. The 2 research questions I will analyze using this dataset will be: number 1, can smoking status, diet, and overall sleep quality predict systolic blood pressure? I'm hypothesizing that women who reported smoking and poor sleep will have a higher systolic blood pressure than those who did not, while those who report eating a nutritious diet will have a lower systolic blood pressure than those who did not. My second research question is: does lower total family income and high job stress increase the probability of an individual being a smoker? I hypothesize that a lower total family income and high job stress will result in a greater likelihood of being a smoker. Firstly, I will use multiple linear regression to predict smoking, diet, and sleep quality and their impact on systolic blood pressure. This analysis uses dichotomous predictor variables to predict the outcome of a continuous variable. I chose to focus on systolic blood pressure instead of diastolic because according to the research, systolic is a better indicator of cardiovascular disease and hemorrhagic stroke, especially individuals aged 50 plus, which is around the age the SWAN study focuses on, middle-aged women. Heart disease is also the number 1 cause of death, stroke is the number 4 cause of death, and tobacco use is the number 1 100% preventable cause of death. I will also be analyzing for diet and sleep quality, both of which can affect blood pressure, to account for any potential confounding from these variables. My independent variables are reported regular smoking since last visit, reported eating a nutritious diet, and overall sleep quality in the past month. Reported smoking and nutritious diet were dichotomous yes-no questions. I turned overall sleep quality into a dummy variable and coded those who reported very bad sleep to 1 and all others to 0. My dependent or outcome variable is systolic blood pressure, which is a continuous variable. I'm using multiple linear regression to generate a regression equation to predict systolic blood pressure. I excluded all cases listed as missing, system missing, do not know, refused, not applicable, or any other invalid cases. Overall, for this analysis, there were 2,039 valid cases analyzed in SPSS. I have listed the individual Pearson R values between each predictor variable and systolic blood pressure. Smoking had a slight positive correlation, while nutritious diet and systolic blood pressure had a slight negative correlation. While the correlation between sleep quality and systolic blood pressure was very close to zero at 0.044. Between Model 1 and Model 2, with the inclusion of nutrition, there was an increase in the overall R value from 0.107 to 0.128. Through ANOVA, the test was very significant, with a p-value less than 0.000. What do these correlation values essentially mean? Since they were slightly more than 0, and Pearson R values spread from -1 to 1, there is a slight positive association between smoking and systolic blood pressure and diet and systolic blood pressure. However, the R-squared value is 0.017, meaning that less than 2% of the variability in systolic blood pressure can be accounted for with the predictors of smoking status and nutritional diet. Here's the regression equation generated by SPSS with the unstandardized beta weights. Y represents the outcome, in this case systolic blood pressure. 116.332 is the y-intercept value. 5.014 is the first predictor variable X, meaning smoked regularly since last visit. -2.488 is the second predictor variable X, signifying those who reported eating a nutritious diet. This means that for every 1 unit increase in reported smoking, there is a 5.014 unit change in systolic blood pressure. For every 1 unit increase in those who reported eating a nutritious diet, there is a -2.488 decrease in systolic blood pressure. At a p-value of 0.137, sleep quality was not a statistically significant predictor. There was no confounding present because the beta weight of smoking in Model 1 was 5.438, and the beta weight in Model 2 was 5.014. Because this change is so small, less than 10%, diet was not a confounder in the relationship between smoking and systolic blood pressure. Here are my outputs from SPSS. Here in the scatter plot, you can see several outliers in the data that could be influence points. However, the data hugs the regression line fairly well in this data set. Here's my coefficients table listing the beta weights and their significance levels. Through the stepwise option, sleep quality was left off as it is not statistically significant. SPSS also found no indication of confounding between Model 1 and Model 2 when the covariate of nutritious diet was added to the model. The distribution also appears normal with the mean close to 0. So what does all this mean in terms of public health? This analysis concluded that women who reported smoking were up to 5 times more likely to have a higher systolic blood pressure, which increases risk for cardiovascular disease, stroke, and heart attack. On the other hand, eating nutritious diet was associated with reduced systolic blood pressure. This can lead to programs and interventions targeting women, as women were the focus of this study. Perhaps gender differences could also be examined to see how women compare to men in smoking and diet habits. Further research could also analyze what impacts total family income could have on access to nutritious foods. Questions I myself have is what influence the rise in popularity of electronic cigarettes may have on blood pressure and other health outcomes. This analysis also backed up the previous research stated in the literature review. My second research question will be using logistic regression to analyze the probability of a dichotomous outcome. This second question, does a lower total family income and high job stress increase the probability of being a smoker, builds upon my first research question. Because smoking status was such a large contributor to increased systolic blood pressure, I wanted to look further into societal level predictors that can contribute to this factor that ultimately contributes to high blood pressure and heart disease. As stated, tobacco use is the #1 preventable cause of death, and the implications for both research and public health are critical. According to the literature surrounding my two predictor variables of total family income and high job stress, people living below the poverty line had higher rates of cigarette smoking. In fact, according to the CDC, people with total family incomes less than $12,500 had higher lung cancer incidence rates than those with incomes greater than $50,000. It is known that cigarette smoking is linked to lung cancer, heart disease, and stroke, and having a low total family income is a risk factor for even being a smoker. An article by Ayagari and Sindelar 2009 reported two main reasons why job stress was related to smoking. First, self-medication, in which people will use smoking to relieve the stress as a negative coping skill associated with their job. Secondly, job stress reduces impulse control, which in turn lowers impulse control over other health behaviors, such as resisting the urge to smoke. For this research question, my independent variables are total family income and job stress. I sought to examine how low total family income and the lowest category were those reporting under $19,999. I therefore singled out the category of less than $19,999 versus $20,000 and greater as my dummy variables. For job stress, I hypothesized that high job stress will contribute to a higher probability of smoking. Therefore, I singled out those who reported very bad stress at work versus all others. Logistic regression predicts a dichotomous outcome, with those over 50% reported as a yes and those under 50% reported as a no. My dependent variable is smoking status, reported yes or no, in regard to the independent variables of total family income and job stress. Overall, 2,329 valid cases were used in this analysis. My overall outcome was that total family income was the only statistically significant predictor in this analysis. Those with a family income of less than $19,999 had a 2.418 greater probability of being a smoker. This was the XV value at a significance level of less than 0, with a 95% confidence interval of 1.699 to 3.441. We can be 95% confident that the odds ratio falls somewhere in that interval. However, high job stress was not statistically significant at a high p-value of 0.905. The constant value was also not statistically significant at a p-value of 0.719. The pseudo R-squared values also need to be taken with a grain of salt, because it is not possible to compute a single R-squared statistic that has all the characteristics of a linear regression model in a logistic regression model. However, we can still report the Cox and Snell R-squared as 0.9% and the Nagelkerke R-squared as 1.7% of the variability accounted for. Overall, 86.1% of the cases were identified correctly. Here are my output tables for this logistic regression analysis. I have highlighted the XB values, and we can see that total family income was the only statistically significant variable. The analysis checked for the default outcome, in this case, with those who reported yes to smoking regularly. So what did this outcome mean for public health and future research on this topic? There was definitely a relationship between low total family income and reported smoking. However, more research needs to be done on the topic of stress, perhaps stress in the personal life versus stress in the workforce. This could allow for targeted educational programming for lower income communities. For example, more educational opportunities, more focus on healthy coping, or community-wide policies to limit smoking in low-income areas. It may also be important to examine other substances. Also, looking into health insurance coverage and policies for prevention and cessation services to support individuals. In conclusion, smoking was a large contributor to systolic blood pressure. Eating a nutritious diet was associated with lower systolic blood pressure, and women who reported a low total family income had a higher probability of smoking. Further analysis needs to be done in regards to other substances and other sources of stress. In conclusion, my research questions were able to connect the line between low total family income and systolic blood pressure in the women of this study. Further research needs to be done in order to be able to generate a real community-level change for the good of women in the study and for the good of public health overall. It requires creating workplace and better healthcare policies promoting prevention and cessation services, and also requires community-level and policy change associated with this research. Thank you for listening.